The number of patients on Long Island continues to mount, and it is testing nurses and doctors like never before. CBS 2's Carolyn Gusoff tonight gives us an exclusive look inside how they're doing it at Long Island Jewish Hospital.
We're in the parking garage of Long Island Jewish Medical Center in Queens, New York, adequately dubbed COVID City in the epicenter of this pandemic. You're about to join me for a 12-hour shift in the emergency department.
Ross Feynman, ER nurse and frontline fighter against a battle he says does not follow the rules he was trained in.
I feel like we're practicing medicine in the 1800s because we don't know enough about this virus. It is like shooting a BB gun at a tank.
The ambulance bay now a triage area.
We got ambulances from Chicago helping us out. Big thanks to them, too. We need them.
Part of LIJ's lobby, tented for COVID patients amid the hum of what he calls the bug zapper.
It's a UV light that's used to sanitize the rooms in between patients.
And overhead, the constant call for a rapid response.
This is what we hear about every 10 minutes. Medical rapid response. These are the patients that are crashing on the floors, ones that are requiring breathing tubes. Unfortunately, pretty soon you'll probably hear code blue, which is the same patient that's no longer with us. It's been 5 minutes since the last one.
The treatment, often not much more than oxygen and turning patients on their stomach to ease breathing. And
basically what we try to do is break up all the mucus and all the secretions that the patients have.
As much as we want to say that we're trained for this, I don't think we can ever say we were trained for a pandemic or trained for people not quarantining. We're not trained for people not social distancing. But I do know that no one here has ever seen anything like this.
We see these patients deteriorate in front of our eyes. Some of them are young and do very poorly. Some of them are older and do great. These patients are sometimes doing well, and an hour later they have a breathing tube.
But nurses like Feynman letting patients know they are not alone.
It is very hard for us because a lot of times we're acting as that surrogate to hold their hand or to tell them it's going to be okay when they're terrified, and they are terrified. And thankfully, a lot of these patients, they do okay. They turn around.
Risking his own health, he has this request.
We can't say enough. You guys people have to stay home. I'll do my job as long as you do your job in the public.
On a positive note, Feynman says they are well fed and appreciate the outpouring from the community, nourishing caregivers, body and soul. On Long Island, Carolyn Gusoff, CBS 2 News.